welcome our guest speaker for this plenary session, Dr. Hosna Salmani, who is going to talk about the role of health information technology to ensure universal health coverage. Dr. Hosna possesses academic excellence and practical expertise with doctoral studies in health information management and a master's degree in health information technology from Iran University of Medical Sciences. She serves as a professor at the international campus of Iran University of Medical Science and previously worked as a visiting research fellow at Maastricht University. Her dedication to developing a mobile application and an EPRO system for cancer patients demonstrates her commitment to improving patient outcomes. Additionally, her experience as a teaching and research assistant has allowed her to actively contribute to academia, specializing in areas such as healthcare, IT, health information management, telehealth, remote monitoring, mobile health, patient-centered care, and much more. She has also participated as a keynote speaker at international conferences and author of books on digital health, which is available on Amazon. She serves as a research topic coordinator and editor for Frontiers in Digital Health Journal and reviews for leading journals and conferences, including MSS, HLTH, MedInfo, and much more. Her work has been recognized with awards from the National Elites Foundation, Gifted and Talented Students Center, the UNESCO-sponsored YTH Live Global 2021 Scholarship, and the International Collaboration Award from Iran University of Medical Sciences. She is ranked among exponential health tech professionals, a top 25 digital health influencer for the year 2023, and a top 10 global thought leader in health tech for the year 2024 to till 2026. In 2024, she received multiple accolades at the Women Changing the World MENA Awards, securing first place for the Changemaker of the Year, second place for Leader of the Year, and third place for Global Impact. In 2025, she was honored with the Women of the Year Award at the Women Changing the World MENA Awards and received the Special Recognition Award for Women in ICT at the Women in Tech Global Awards by the Women Tech Network. She is also working as an expert for the technical and strategic advisory group at the World Health Organization. And she is also a member of the Virtual Care Committee and Global Proposal Review Task Force for the Healthcare Information and Management Systems Society. And she is also a member of the Digital Health Communities of Practice Leadership at the International Federation of Health Information Management Associations. And she's completely committed to driving innovation and advancing healthcare. So, ma'am, this is really a great privilege and our honor to have you here. The stage is yours. Thank you for joining.
Thank you so much for the introduction. Thank you for invitation. I can also share my presentation right now.
A special welcome to you, Dr. Hosna, joining us from Iran.
Thank you so much. Thank you. Can you see my screen?
Yes.
Not yet.
Okay.
Yeah.
It is still saying yes. It is now fine. Please go ahead.
Let me go ahead. Okay. Hello, everyone. Thank you so much for digital health and health information technology to ensure universal health coverage. So what I want to say is about something related to background and introduction of UHC or universal health coverage, health insufficient progress around the world, primary health care as a pathway to UHC, and digital health and universal health coverage, and successful application of digital technology, how technology or digital health can play a key role in achieving UHC, why digital health is important to reach UHC, and the digital dimension of UHC, key challenges, barriers, and political action to enable UHC for our health system. So you may heard about the UHC or universal health coverage, but it means that all people should have access to quality health services whenever and wherever that they want. For example, they need without financial hardship. For example, if someone wants to access the information, they can log in and see everywhere, you know. So it can include the full range of essential health services from health promotion, prevention, treatment, rehabilitation, self-management, palliative care. And also, it can also cover the chronic diseases. Although most countries have expanded access to health services, but and there is, for example, the gap for low and middle income countries and all countries, so not meet the goal of UHC by right now. And there is the goal and aim to reach UHC by 2030. So now in the current digital age, you can see that usually most people access to the internet around the world, but some people, as you know, can face difficulty and problem. So it's important to see the adoption and use of digital technology for example, some communities related to women, children, and it's very important to consider all of them. So at the United Nations high-level meeting in 2019, world leaders reaffirmed their commitment to extend UHC to everyone by 2030. This 2030 it's like an agreement that in the meeting. So about the statistics, around half of the world population still lack of access to primary health care. So UHC can cover and should cover primary health care. So it's very important. So the access to primary health care is one of the essential key that we should consider. At least 400 million people cannot obtain even the most basic health services. So it's you can see that the number, and it's very important to consider all. And the number of people at risk of falling into poverty because of the out-of-pocket health expenses is rising, or most of the people don't have insurance. So with 930 million individuals currently facing these threats. So you can see the insufficient progress that is being made towards UHC, that it's related to the age and related to the globe. So you can see the most of the countries can't support, and as I mentioned, middle and low country still the gap to reach UHC. So primary healthcare as the pathway to UHC. So comprehensive primary healthcare, as I mentioned, is an essential foundation for achieving and reaching UHC. So UHC, if I mention UHC, means universal health coverage. So PHC system is primary healthcare. Can cover most of the person's health needs throughout their life. So it's important to consider primary health care first, and to reach and achieve the universal health coverage. So by bringing health system and services to communities, we can, for example, guarantee the access to healthcare, and it can also improve health equity. And equity is very important in universal health coverage because we need health for all of the people. So, despite its importance, usually we can see that primary healthcare is often underfunded, understaffed, or fragmented, and not given at the same level because of the policy, because of the law, and this is very important. I will mention the challenges in my slides further. So innovative approaches is needed. So because for example, universal health coverage with internet can also guarantee digital health. So the majority of the world's population are covered by some form of the internet network. So adoption of digital health and digital technology is very important. But I mentioned that we still have the problem, but there is several solutions to reach universal health coverage. So, in digital health, therefore, has the potential to become an important driver to help countries to achieve UHC, and it can be like a health for all. So, digital health is important and can be part of the health system to reach universal health coverage, and it can, for example, be like extracting data and extracting, for example, data for the research, and then we can analyze the amount of data. It can be like a big data analysis to see the future impact of the disease. For example, it can be one of the impact of universal health coverage. So it can be digital health because the technology every day or maybe every second is evolving. So we can consider, the new technology and most developed technology to the way to reach the healthcare and improve the universal health coverage. And the value of the public is very important, and we should also prioritize equity and human rights. Human rights is very important to achieve our goal. So transform health goals to, for example, achieve universal health coverage by 2030. It can be possible by harnessing digital health technology. So and also the use of data, because currently you can see the AI and artificial intelligence. So it can be important to consider data, and then there is also several consideration guidelines to see how we can use this kind of data. So, but however, it can require the leadership and collective action to everyone to achieve their or realize the right to health and enjoy the benefit of digitally enabled care. So everyone can benefit, not only, for example, few people. That's why if, for example, few people also benefit from digital health, it can't be universal. Universal means like this, that we can provide the universal health coverage. So transforming a formal health system and services also can offer novel ways for individuals to also self-manage and promote their own health. You know that the patient-centered care or home care, remote monitoring can also be like it can be like an umbrella term for patient-centered care, and it can cover by this kind of technology, and the patients can then monitor themselves at home. So it was something that I developed two systems for cancer patient, and it was like one of them was self-management, and another one was electronic patient-reported outcome system. So the patient could monitor themselves, and they can, for example, fill out several evaluation questionnaire, and they can, for example, see the result. The patient can see the, for example, their monitoring status, and also they can connect with physician and also nurse. They themselves can manage their health. It's very important. And one of the aspects of universal health coverage can be patient-centered care. So why digital health? Because as I mentioned, it can also can enable the self-management of healthcare, and it can the governance, funding, and political will can affect the adoption of digital health. So the successful application of digital health depends on effective governance and supportive enabling environments. So it can include high-level political support, policies, legislation, and regulation to build trust and guide the use of technology and data. As I mentioned, for example, it should be have several guidelines because, for example, currently AI there is several guidelines for AI and regulation because it's very important to consider adequate level of funding, health workforce capacity building, training and support, effective and integrated management structure, incentive system for staff to adopt and use digital health tools, and also oversight and accountability mechanism. And also everything can also be dependent to financial and government because it's very important to consider all to achieve universal health coverage. Yes. So how can digital health play a key role in achieving universal health coverage? One of them is improve health access and close equity gap, because if we want universal health coverage for all, we can also close equity gaps, strengthen primary health care, maximize health outcome and public benefits of health data, improve more inclusive health governance. And I will explain all of them. So for improved health access, as it's clear, it can be, for example, when we want to implement systems, can be equitable, sustainable, inclusive manner, because it's very important, and we want this to strengthen and scale up access to primary health care and services. So it's very important to close equity gap and advance universal health coverage progress. So the second one is strengthen primary health care, and digital health tool can also improve the quality and efficiency of health services, so it can address health system barriers by enhancing access to information and data, access to services, ensuring more effective system integration and exchange. Health data health information exchange is very important. So if you want to see all of the systems are integrated together, we should provide the standards, and sometimes we can see the several challenges related to language, and it's very important to consider all and engage individual from the first step in our progress and our, for example, approach, because it's very important. For example, in our project that we've done before, so it's like a need assessment, and before implementing the system, we have need assessment, and then the patient or physician are aware of what will happen in our system. And at the end, we had the usability test to see the satisfaction of our user. So digital health tool can increase efficiency in the management of health budget. I mentioned that the financial analyst budget is very important, because if the system integrated, you can see all of the the progress, and you can see everything that happened in the system, and you can, for example, control them. And like the surveillance system, like a dashboard, and like, for example, electronic health record, it can also cover the system, and for example, from birth to death, and data and information. So let me see the next slide. Yes. So maximize health outcome and public benefit of health data. So health data, I mentioned that is very important because we can have the amount of health data that being produced, used, and stored. So we should, use it effectively for decision making because for advancement in research and innovation, for also achieving equitable health care access and healthcare, for example, coverage, and also can improve the health emergency and pandemic response. In my university, during COVID-19, we have the data center that the data that developed from the hospital by the hospital, they will also they analyze and then they decided what kind of medication and what kind of drug needed for future intervention. So it's very important. And also it can also help strengthen public trust in health and data system, which is it's critical to improve data collection because if the patient or physician trust our system, they can fill out the data. It's one of the first steps that they data entry. So the trust is very important. And also this digitalization can increase timeline of data sharing and the efficiency in use of health personnel or like for example personal health record and also supplies, and the use of improved analytical tools because of the big data analysis, and can also support more effective and equitable policymaking, planning, and allocation of resources. For example, if some city or cities need or country needs more, for example, facilities, we can provide by the system because you know that, for example, one of them you can add the GPS and GIS, geographical information system, and to see that the resources which city or which hospital they need, and we can, for example, allocate of resource for them. So improve a more inclusive health governance. So digitalization can improve transparency and accountability. It's very important because you can see everything in the system, and if someone delete or remove or that, and for example manipulate the data, you can understand. So the use of digital platform can also help improve inclusive process by increasing opportunity for the civil society and diverse community. And it can also improve for policymaking, as I mentioned, and also it can increase accountability and transparency by making facility, regional and national level data availability for to the public, and can, for example, make everything online and facilitate a feedback mechanism. So the patient or physician can give us feedback, and then we can improve the system after receiving them. So the digital dimension of universal health coverage, it can also cover, I mentioned before, all together, but if we want to, for example, see them in detail, it can be like service coverage, service coverage, population coverage, and financial coverage. So service coverage, it can include all of the system and everything related to, for example, digitalization. For example, telehealth, self-care, or remote monitoring, everything. So you know that it can also covered by governance. It's very important, and also financial coverage can reduce costs and also support payment. If we add new services and system, can be go further, and then we can see the for financial, can see the digital insurance system, and because it can improve the efficiency. Also, one of them, it can be population coverage, and because it's universal health coverage, it should be reach more people. So service coverage can be new and enhanced services. We can provide it, and also it can improve quality of services through, for example, digital training, learning opportunity for health worker, and improve feedback mechanism. I mentioned leverage telehealth and telemedicine because to provide, for example, specialist services for under served cities, or because some low and medical middle income countries, they don't have access to the specialists. That's why telemedicine and telehealth can also support them, and also mobile health is very important. And also we should it help us to reach more health information, and it can also help to getting more research, and also can analyze and research for the future, analyze data for the future decision. So also generating demand to increase uptake of health services, including reminders, and also strengthen continuity of care. Continuity of care is very important because it can also support universal health coverage and can support service at all of the levels. And also, for example, palliative care is after treatment, can, for example, follow up the patient, for example, with cancer, especially, or chronic disease. And it can also improve the collaboration, because if we have the integrated system, all the we're going to see the data. Population coverage can extend coverage of health services to remote and rural population. Rural population very weak to reach a digital health platform, but we should provide health services for them through the, for example, mobile internet connection. It's something that they need. So also reach underserved and marginalized population, like, for example, children, like women, like old people, and also reduce the overall burden of health system, enable the individual to access the health information and provide patient-centered care. Several examples of service coverage can be like personal health tracking or personal health record, healthcare provider decision support, healthcare provider coordination, healthcare provider training, prescription and medication management, laboratory and diagnostic imaging management. And also related to population coverage, it can be targeted client communication, client identification and registration. If I say client, it can also come back to the patient. So, for example, someone who is healthy, but they need to prevent, they need to, for example, participate in several laboratory tests to prevent the disease. For example, cancer can be one of them. So telemedicine, health work activity planning, and also scheduling. So another coverage is financial coverage. So it's reduces the cost of services. So reduces the direct and indirect costs, out-of-pocket costs, because all of the costs all of the costs is transparent, so everyone can see. Increase efficiency in the management of health budget, provide greater access to cost sharing option. So eliminate the use of cash, because if, for example, everyone can pay online, you can see that the money, what will happen for the money, and you can see the payment. For example, you can serve for the disease or for the prevention solution and something like that. So link services directly to insurance. So currently also in Iran, there is the system that can support by Ministry of Health and electronic health record. So it can support a whole ranges of data, and it's extracted from the hospital and especially public hospital. So general hospital, I mean, and also private hospital. Also, they are going to also report their, for example, data to the Ministry of Health. And also, there is one solution for the medication system because there is one. Most of the people undercovered by one insurance system, and this insurance system can also integrated with medication system and hospital. And when someone give them the code or identification number, they can see in their medication in the drugstore and they can receive their, for example, medication. And also the same happen in laboratory and also, for example, imaging department. So it's very important that everything, for example, connected. So, and also everyone can see the progress. Health governance is very important because it can also support and increase opportunity for civil society and diverse community, and also increase accountability and transparency because by making, for example, facility, regional and national level data available to public and create feedback mechanism, and also because it's very important for building trust and also executive more effective decision making. And for example, clinical decision support system can be one of the example of this kind of system, but at the for example political, it can be somehow different because we need to provide dashboard, provide the detail of data because they need specific access to data to see the progress. For example, usually they need financial data, for example, management, some data related to the budget and to see the future plan and increase timeline of data sharing. One of the example is clinical financial transaction, but this can be integrated in one system. For example, in one hospital, everything can support by a hospital or health information system. So it's very important, and each section and each part of them can covered by one organization. For example, financial department and something like that. So health governance also can be like a client, how we call human resource management, for example, equipment and asset management, facility management, data collection management and use, and data exchange and interoperability, because they see them at the high level. So we say about the good things that related to technology and how we can reach the universal health coverage. But the key challenges in achieving digital health transformation can be low political will, weak legislative, regulatory, and policy environment, unclear funding landscape, and insufficient allocation of resources, lack of inclusive and participatory approaches. So related to low political will, because weak political understanding and support is prevent the right investment and action. So it's very important to see the political the policy that can like one asset that help to reach universal health coverage, not for example they for example provide the gap that for example they ignore reaching health and health coverage. So it can be like equitable and inclusive digital health transformation, can be sustainable adoption of effective digital solution, and can help achieve health for all. And also many countries can also face weak governance and health system, but we should try and we should see the new technology that can help them, and new also guideline, new role and new rule that can, for example, help them to improve their healthcare. And first of all, also we should see the need that is in the hospital, in the society, in the, for example, in our group that we want to interfere and create the system for them. And also weak legislative, regulatory, and policy environment. In many countries, I mentioned that the problem with this, but we should see the regulatory and policy environment should provide them to guide development of digital transformation. So it can be equitable, and also we need to we need the legal foundation for health data use and privacy, digital literacy, and also policy for what kind of digitalized health system. For example, in our Ministry of Health website, and also they provide several, several, for example, guideline that can help companies that they want to develop the system to provide the best system for what they need. So it's very important. And also it can be, if we provide a transparent public policy environment, it can increase planning and investment, certainly for international donors and also the private sector, because it's very important. They should, be aware of what will happen for the future plan of the organization and also the governance. And also it's very important for multi stakeholder engagement that we should include them, because for example, all of them, they should engage in our process. And also we can see the health data. We should benefit from health data that we extracted from the health system, because it can manage risk, protect individual rights, and also improve health outcomes. So, okay, and the third one of the challenges is unclear funding. Unclear funding landscape and insufficient allocation is very important, because this fragmentation can affect the digital health sector. So we should provide a structure and incentive structure to see the what they need, and the funding also, and the resourcing allocation flows. That's very important. We should also consider all for also all level actually. So most health funding also is directed toward health specific programs, and it's very difficult to untangle the funding dedicated to the digital transformation of health system. And also there is a lack of publicly available information on current funding, because also the gap in domestic and external funding for digital health. It's very important to integrate all. Also, it's because we can see them in low and lower middle income countries, and also it can also provide several barriers for mobilizing additional resources for digital health, more effective donor coordination, and better alignment around country priority and needs, and also to ensure funding priority in the right areas to ensure the equitable and sustainable digital health transformation and access. And the four challenges is a lack of inclusive and participatory approaches. So usually, for example, most of the people are not informed. For example, the women use marginalized group, so it can be who are being left behind the effort. So we should provide and train them to see that they also can, for example, be able to achieve global health goals. So it's very important to see all of the community. So also it's vulnerable person like health workers can be, for example, be aware of these changes and technology, and we should empower them to contribute to this change and hold a decision in our process. That's why it's very important to, for example, assess their need, the first level, and then continue the process. If you don't know the need, so and the goal of our, for example, project, it can be waste of time because at the end we can't use the system. And the barriers to leveraging digital technology for universal health coverage, it can be like, for example, individual or community level barrier, national level barrier, transnational barriers, and also ethical and human rights. So for the first one, knowledge, resource, and system coverage constraints have led to the exclusion of large group of people from enjoying the benefit of digital health. Everyone should, benefit from the digital health. So you can also see several um, challenges. One of them can be lack of connectivity. The second one is non-inclusive processes. The third one is a lack of digital health literacy, mistrust of digital technologies, and also vested in interest. Lack of connectivity, so you can see in the underserved areas and also rural people, they don't have access to the internet, and also we should provide them the digital tools to and learn about digital health to see how they can manage their healthcare. And the second one is non-inclusive processes, and it's often overlooked. Children, youth, women. I mentioned people with disability, and also resource-constrained communities. And it can lead to tools that are inaccessible and irrelevant, harmful, and for these kind of groups. And it's very important to provide the surveillance system and control and monitor this kind of progress. And the third one is allow digital health literacy. And digital health skills is very important, and currently can be one of the trends because we should first improve the health literacy, and then teach them how, for example, struggle to use digital health tools and to manage their data, and also to, for example, monitor their risk and their status and situation. Mistrust of digital technology, because that trust is very important usually in the people or someone with some diseases, for example, HIV, cancer. They don't, or they rarely can trust the system. So first we should persuade them, and first we should explain the benefit of using this kind of system to monitor themselves. So perceived ease of use is very important, that this trust shaped by perceived ease of use, quality of care, cost, data handling, and provider reputation. And the lack of this, it can lead to suspicion and reluctance to adopt a new technology and new tool. And also the fifth is vested interest, those benefiting from the current analog system, or for example, old people, they really can accept a new technology. They may resist new technology, and it's very important also, as I mentioned, to persuade them, because it can be one of the transparent solution for digitalization. And we can say that how they can benefit from existing process. And the second challenges in national or barrier can be national level barriers. According to WHO, it has a strategy toolkit. We can see 7 building block or component, and we should monitor them to achieve the global health coverage. One of them is leadership and governance. strategy and investment, service and application, standard and interoperability, infrastructure, legislation, policy and compliance, and also workforce. So for leadership and governance, I mentioned before, we should, for example, this is the barrier that we can see: lack of unified direction and leadership, lack of, for example, among the policymaker, weak oversight and coordination, lack of governance mechanism, and also for strategy and investment, for example, can be weak national digital health strategy, and to, for example, that can be aligned with universal health coverage goals. So insufficient domestic and external resources, and it can be another, structure, and you know organizing, for example, this kind of strategy and the guidelines very important. And also short-term approaches to strategies, for example, if the manager of the system change, all it can affect all of the system. So short-term approach, it's like a, for example, vulnerable, and we should consider the long-term approach for digital health technology. And service and application in such insufficient tangible digital health services and system, and insufficient access and exchange and management of data and information, and also standard and interoperability. Still, we have the challenges with exchanging data, but with providing specific standard, and so that and also, for example, providing specific guideline structure, we can see that the companies also, the private sector also can follow the rule, and for the future can see most of the system integrated together. And also legislation, policy, and compliance. It can be weak policy to guide areas such as the data ownership, and security is very important, because, for example, it can be, for example, one company that say data is for us. The organization can say no, the data is for us. And so it's very important to, for example, see the structure and provide the data ownership for our system. And also, I mentioned this kind of technology before, and the workforce, because is not sufficiently informed about the technology and the process. We should inform them by training, and by, for example, improving their knowledge and skills. The third barrier, the transnational barriers, can cover two. One of them, regulatory and quality challenges. Another one is weak and fragmented governance. So this can difficulty, regulatory and quality challenges can see the difficulty in assuring the quality of digital health tools, preventing health misinformation, and protecting user data. Influence of technology company, because of, for example, the vulnerable people or groups, and maybe the technology is harmful for them, and lack of safeguard to ensure major player that, for example, this system is safe and they can trust. We can fragment the governments, so lack of coordinated national quality control for digital health tools. So, for example, you can see right now that technology is developed, but there is no monitoring, especially in academic. But if you want to develop in, for example, this in action, we should provide one, the evaluation test and control to improve the translational barriers, and also inability and unwillingness of large companies to distinguish scientific facts, most of them from unproven opinion, leading to exposure to poor health advice and misinformation, because most of the data that they, for example, gather is not based on evidence. So it's very important to consider. And also a slow and fragmented effort is to validate the online health information is very important. Four is ethical and human rights concern. That's one of the important barriers that we talk in biased and unrepresentative data, in data exploitation and misuse, privacy and surveillance, protection of vulnerable group, and environmental impact is very important. AI model because can produce incorrect diagnosis, and so we should also consider in this kind of AI solution. Data misuse because usually, for example, they use data without any consent, without informed consent. So, for example, several insurance companies. So it can be like people don't want, for example, to share their data with all of the people. So it can be without, for example, identification number, without their name, because and we should, for example, provide informed consent to provide the trust and persuade them to participate in our project. And also privacy and surveillance. And digital health increases the potential for intrusive state and corporate surveillance. Lack of clear data ownership complicates privacy rights. And also protection of vulnerable people. I mentioned it's very important to consider because they are at risk of online harm, and also environmental impact and the infrastructure supporting digital health, like a data center, energy consumption, and e-waste has a significant environmental footprint with long-term consequences for global health that we should consider. Political action to strengthen digital enabled health system. And regardless of the level of digital health maturity or economic development and everything, or for example, usually we can see the gaps for the adoption of the digital health technology. We can see several recommendations for action, and because we, as I mentioned, we should achieve universal health coverage by 2030. So the goal is ensure equitable access to essential health services for all without financial hardship. There is 6 steps. And the first one is put community at the center of digital health. And the second one is, I will explain all of them further. The second one is design and implement a digital health strategy that will deliver universal health coverage, support health workforce that to enable digital transformation, ensure strong regulation and legislation to create an enabling environment, and also the another one is increase domestic and international investment to strengthen digitally enabled PHC system and empower community, create a global government framework for health data to maximize the public benefits of digital data while safeguarding individual privacy, ownership, and security. And the first one is put community at the center of digital health. So we need to, for example, include everyone. For example, diverse community, especially marginalized group, as I mentioned, children, youth, old people, women, people with disability. They need to involve in all stages of, for example, planning, design, implementation, monitoring, evaluation, assessment, everything. So it's very important to creating the trust. Also, it's very crucial for shaping digital health and data governance and ensuring equitable access to digitally enabled primary healthcare system. And the second one is related to the strategy. And in collaboration with community and also partners, they should create And the government should create an executive national digital health strategy. And they should, for example, create a strategy, and also they should inform people how to use, and they should, for example, provide training and support to, for example, provide digital strategy for all of the healthcare solution. And also, this strategy must align with principle of equity and human rights that can be fully costed and financed, and also detail how digital health can or will advance all aspects of universal health coverage, and also transform health is actively working with governments in key countries to ensure digital health solutions are developed and implemented effectively for universal health coverage. And the third one is related to support workforce, and the frontline health workforce is very health worker uh, is very crucial for achieving UHC, and they need to be well equipped, supported, and also paid with adequate training. And we should support them. We should improve their skills to use the technology, and also it's important that, for example, health system manager and policymaker to consult these workers before introducing new digital tools. I mentioned that we should engage people before starting the for example, steps. And also, innovation are helpful rather than burdensome. We should ensure these to them, and also effective management structure are also necessary to enable health workers um, to improve digital health technology for improved health access and quality. And also, Transform Health is working with partners to ensure digital health solutions to support frontline health workers. We should also ensure strong regulation and legislation. So it's very important to update the digital health, for example, regulation, because of the we are in the digital age, and we should address both benefits and also risk of digital health technology in healthcare. And the government should modernize in these law, and also allow digital health providers to operate more effectively and efficiently to support universal health coverage. And also it can include creating new legislation for electronic health record regulation, telemedicine, and also you can see currently there is some structure for AI, and they allow in healthcare for basic, for example, prescription, and establishing guidelines for the recognition and reimbursement of digital health services. And also, broader data and digital health regulation can be reviewed and reformed from the universal health coverage and also human rights perspective. We should provide and consider human rights, and we should protect vulnerable user from digital health harm. And also, Transform Health is conducting analysis in priority countries to influence decision maker in creating a supportive environment for the digital transformation of health system. And the fifth is increase domestic and international investment. Investment is very important, and because to advance equitable and digitally primary healthcare, we need financial support, and investment in this case is very important, because usually technology running or developing technology at first it's costly, but when you can see the effect, it can decrease the cost. So this is a crucial part of broader effort to improve health financing and reduce out-of-pocket expenses. And it can also focus on enhancing digital health literacy, and also it can future like a future guarantee to fully benefit from digital health And also sustainable long-term funding is needed for this kind of mechanism and for reaching the primary health care and at the end universal health coverage. And also related to the sixth one is create a global governance framework. And so because when, for example, we provide the environment with infrastructure, internet, and everything, all people and institutions can share, use, and benefit from data. Can, for example, and also researcher. And it can be like a collaborative approach, and can, for example, develop global framework for the governance of the health data that we need. So and the government also should work with WHO, regional bodies, civil society, technology company, and other partners to a global governance framework that can maximize the benefit for example, the people and providing equity and human rights. And this can be endorsed by government and regional body and be swiftly implemented domestically and also transform healthcare is pressing government and multilateral institutions to develop global health data governance framework undermined by a set of principles based on equity, inclusion, and human rights. So it can be like a summary that we need to maximize the benefit of digital health technology and data for everyone to achieve universal health coverage. We should governance accelerate or governance or we should accelerate and expand equitable access to digitally enabled primary healthcare, strengthen governance framework, and mitigate ethical and human rights concerns associated to digital health adoption. And also assess and improve the availability, accessibility, and acceptability and the quality of digital tools. We should provide it and prioritize the, for example, community to achieve the equity of healthcare. We should address the need of diverse population group, children, youth, women, and the marginalized community. And we should simultaneously address the digital divide and other adoption barriers to prevent widening health inequity. And also digital health approaches must be fully integrated into broader health system because, for example, if someone wants to develop the system, it should integrate it with the hospital information system. And if, for example, the separated come, it can, for example, the physician or the patient can't accept the new system. And if, for example, we fully integrated into broader health system, it can be like one of the solutions that can help them to use this kind of system. So digital health is a complement, not a replacement. So because we need to also provide traditional health service delivery or human interaction, for example, for surgery, for everything. And then the technology is only one, supportive tool that can help them to improve their, for example, workflow and to improve patient support and healthcare. And the foundation for success is a strong political will and leadership. That's very essential. And increase domestic financing for health. That's very crucial to invest digital health system. We should address risk globally, and global agreement are needed to protect individual from digital harm. Clear international rules on data ownership is needed to see, for example, health data for one of the, for example, international rule that can be shared and stored and, for example, collected. International collaboration, coordinated action among governments and international organizations also is needed to reduce health inequity in between and within countries at different stages of digital development and support innovation while ensuring equitable consent. So in this digital age, as a summary, it is unacceptable that half of the world they don't, for example, have essential access to healthcare. So digitalization and appropriate application of digital technology can enhance their access, and it can be the central part of the country's approach to increase their effort to achieve universal health coverage by 2030, and the health will continue to be transformed by digital innovation and new technologies. And also, it's imperative that they are designed and used, governed, managed, monitored in ways that will allow everyone to enjoy the benefit of healthcare and digital health. Thank you so much for your attention. If you have any question, I'm here to answer. Thank you.
Thank you, Dr. Hosna, for this wonderful presentation. Really very interesting and very insightful presentation. So we have a few questions in the chat box. Are you able to access the chat box and those questions?
Yes. Yes, I can see that. I can see the question related to the digital health, and they mentioned that how can we solve the issue of digital health, and can AI be the solution? And if yes, what? Let me see. There is one. Education will be needed. About the AI education, the AI is kind of technology. As I mentioned, first we need to provide the structure and the solution, and we should engage community at first, and then we should, for example, add technology or, for example, to our system. AI can be one of them. Mobile health, everything. There are several range of technology that you can see, Internet of Things, and but after, for example, developing this kind of system, and after, for example, need assessment, we should involve them to participate in our project. And at the end, we should, for example, evaluate and get their feedbacks to improve our system. This is the process, and also the education is very important. Training, they need to improve their skills before using this kind of system. And also, we should provide incentive to persuade them to use. For example, for physicians, usually the financial incentive is very important. If something is free, you can, for example, expect that they might not be used. But the research and academic is completely different. But in action, we need to see and consider all aspects of the development of the new technology.
Dr. Hosna, I'm sorry to interrupt you here. My question, the first part of my question was, in digital health, we see too many pilot projects. So we see in every health sphere, be it public health, be it therapeutic area, health, we see too many pilots. So we have too many tools, too many apps, too many programs, and they're all pilot projects and ultimately don't get scaled up. So that is the problem of digital health at the moment, that almost everybody is using one or the other tool, but it's not holistic, it's not complete. So how to scale up with an ocean of tools available with everybody these days?
You know that I was in Maastricht University for the research fellowship, and I saw several countries, and I talked with several experts in several European countries like Austria, like, for example, Czech Republic, and everywhere. And they mentioned still we have the gap with integration. One of them can be language. For example, we use different languages. We need to, for example, persuade the physician to write, for example, prescription in English. In several countries that I visited, they mentioned that also the prescription also is in our language. So, but in Iran, no, the prescription is in English, and we, for example, have this integration. But still there is a gap, and also integrate all of the company and this kind of, um, for example, private sector. Still there is, we should persuade them, and it's very hard. And we should see some effort from WHO and the structure that persuade them to create and to reach the universal health coverage. Still, we have gaps to arrive, but I hope in near future to arrive, because there are several companies, there are several solutions. Still, the university provides several systems, but we need to, for example, support them and invest in the system with their need. If, for example, they need something, if they, for example, their need is, for example, improving the psychological, for example, problem, and they invest on the system that they are supporting this kind of disease. And that's why we need to see what they want, and it's very important to see the need of the society, and then, for example, start developing system. For example, I also was reviewed several companies that they submitted their project to the conferences in US, and I saw that, for example, most of them has overlap, and some of them, for example, add AI, another one for no AI, and this is something that playing with word, playing with the title of the project. But if you want to see the and reach the universal health coverage, it's very important to see the need of the country, or need of, for example, the organization, and then start developing the system. For my project, it was related to electronic patient-reported outcome system. For example, it was academic project, and I'm also want to provide it with everywhere, and they mentioned that how they can, for example, they use. For example, currently, physician, they don't have time to fill out this kind of thing. Still, we have gap, we have barriers, and we have the challenges to use technology, but the time will solve the problem. As the COVID-19, you can see that at the time of the COVID-19, most of the platform came to online, and they support all of the, for example, processes online. And if, for example, the company integrated with the organization system, or, for example, hospital information system. For example, in Maastricht University, we work on the rheumatoid disease, and we provided the telespa study, and it was one system that worked within the hospital information system. After changing the system to Epic, the system again, they need to, for example, programming, and this kind of gap is still exists, and we need to first provide and see the, for example, aim and the need, and then start and engage community to participate in our project. And integration is very important support.
And apologies, my throat is not really very well today, but I thought that I'm going in a doctor's conference. Probably I'll get some tips. Okay. All right. So thank you for having me here, everyone. And it's a privilege to be here with such a distinguished group of educators, researchers, and industry leaders as I hear you. I congratulate James Lind Institute and the entire management and team Dr. Ali, Dr. Blessy, who has been handholding all the candidates, and the scholars for bringing in their thoughtful presentations and research derived from huge, extensive years of experience, which is visible in your presentations, honestly. I really enjoyed hearing your presentations. This knowledge powerhouse at James Lind Institute can achieve extensive outcomes, I believe, when synergized via these platforms and researches and further EU fundings going forward. We hear that they are the key priority areas in the Europe, which is, and one of the major areas is the healthcare and the digitalization of healthcare. And there are a lot of cross-country collaborations and research is happening, and there are a lot of European fundings which are available for these initiatives in between the European countries and for the sub-Saharan African region specifically. I feel that these platforms of the research and all of you who have presented together with your faculties can really aim to apply at the next level for these EU fundings, at least try for this. I feel that there is a huge potential for having these European fundings in place. We are doing a few at Rushford. So as you know that I'm the Chief Academic Officer at Rushford Business School, which is one of the premier schools in management based in Switzerland. And that is where what we are doing there at the moment. We are enhancing research and development processes and the research outcomes. And along with that, publishing your research. We'll be very happy to have the collaborative researches with James Lind Institute and also the European Union fundings applied in the field of healthcare in association with James Lind Institute. I'm sorry for this. Just give me a moment. All right. So today I would like to reflect on a fundamental question as a management educator. So what's the true purpose of education? Is it degree, certification, academic knowledge, or is it something deeper today? And specifically at the time of the inevitable change, where change is everywhere. So I really feel that the purpose of education is skill development, wherein we all can think, adapt, and act effectively in an increasingly complex world. A true skill is an ability to do something with clarity, confidence, and almost effortless precision, and built through understanding, practice, and reflection. And it's no longer enough to specialize in one domain alone. So all of you are the healthcare professionals. I hear that many of you have done several qualifications and now have achieved so much. So it is at a time of integrating all that knowledge through the innovative thinking, holistic understanding, through continuous reflection and the quantitative and the technology-based integration into any field. So we at Rushford, we aim to provide this holistic leadership-oriented skills through management and the data-driven decision-making, and a capability to understand complexity, evaluate evidence, and make informed decisions. And we see this transformation reflected in our learners, with the learners from so many different countries. We have learners right now from 40 plus different countries at the various levels of the mid to senior leadership roles. They're just not learning, and they're applying, questioning, and contributing to the level that our faculties are so respected with so much of the research outcomes. Some of our faculties have 50 plus Scopus Index publications today. Some of our faculties have Edge Index of 25 plus. We should have that environment employed to generate and maximize those outcomes for all of us who are the stakeholders together with James Lind Institution and Rushford Business School together. So today I'm delighted to share that we are also launching Rushford International Journal of Business Impact. And we are very happy to have this collaborative research published with James Lind Institution with all of you who have presented and are willing to publish. So to conclude, I will not take much of your time, but then just we look forward to creating and shaping this future, one learner, one decision, and one impact at a time. And to enhance the overall research outcomes, we aim to collaborate with James Lind Institution together. Thank you, everyone, for having me here. And I hand over the board to Dr. Ali.
Thank you, Dr. Kanika, for your words. Now, as we are moving towards the session closing and also this conclave closing, now I would like to invite our Director of Academics, Dr. Suhail, for his reflections, remarks, and conclusion. Thank you.
Thank you so much, Dr. Anita. Thanks, Dr. Kanita, for being here. You seem to be under the weather, but thanks again. Thanks being here. So it's really been meaningful hearing you as an educationist, words which encourage our students and help them integrate the knowledge they acquire from the group of institutions both of us belong to. So we had an academic feast for the last 2 days. I think each one of us who participated and presented would agree to me, and it's been your contribution, it's been your knowledge, expertise, your research, which you have brought forth on the table in the discussions, which has made this conclave really meaningful. And I'm certain that we will go back and take a lot of information, meaningful information, usable information, and evidence-based information back to our practices. We will be we'll be doing many more such sessions in future, and I expect that each one of us would participate, and we would even encourage our peers, our colleagues, our fellow students, and fellow researchers to be a part of it as well, not only the students and the members of James Lind Institute. So please do share the information with your colleagues, with your peers, what we have learned in this conclave. Special thanks to our plenary speakers, Dr. Tatiana, Dr. Tayyaba, Dr. Yomna, and Dr. Hosna, and especially to Dr. Hosna speaking from Iran. And they shared their experiences, their learning, and especially in the areas of digital health and AI, which is going to impact almost every walk of life, and we are not immune to it. So we've learned a lot. Thank you so much, all of us. Thank you so much, all of you. Special thanks to Dr. Blessy, Dr. Anita, the admin team, the IT teams, and everybody who has made this conclave possible. It's been together for 2 days, a few hours every day, but it has taken months together for each one of them to make this happen. There's a lot of back end work which has to be done to get us all together. I would like to again thank all the presenters, those who presented their posters, their research studies, their manuscripts in this conclave. You've been wonderful. You've followed the rituals of the whole exercise. You've been scientific, and you have contributed meaningfully to this conclave. I welcome you to James Lind Institute further educational endeavors, and I thank you one and all. Thank you so much. Have a lovely evening, and God bless you.